how and when to measure. We need to measure at the implant level. I told you, this is extremely important. So the question is, may we have confusing readings? If you have used the SmartPeg multiple times, then it's not precise. If you have the wrong SmartPeg, of course, so you will have a wrong measure. If you have some soft tissue between the SmartPeg and the implant, then you may have a problem. As well as if you have little bone spicules, you see, you cannot insert the SmartPeg perfectly well, and the value won't be good. You need, if you think you have a strange value, check if the SmartPeg is enough tightened. And sometimes you have an angulation to 45 degrees. You shouldn't go be more than 45 degrees when measuring the initial stability.